Today is our 220th Zoom session. For last 289 days, we are conducting Zoom session without any break. Actually, the International Forum for Promoting Homeopathy is formed with the intention of promoting homeopathy to the entire world and unite homeopathic doctors of the together in a platform with homeopathic lovers and homeopathic students. So this is a non-religious and non-political organization formed only with the aim to promote homeopathy. Many doctors from different countries are coming in this forum to share their experience and views. So that will benefit us each other. So that is the main aim and intention of International Forum for Promoting Homeopathy. So today we got Dr. Ismail Sait again to explain about the Down syndrome, and he will share the cases about Down syndrome. There is no need of introduction for Dr. Ismail Sait.
Anyway, give some introduction.
Whenever someone says about homeopathy, the people remembers the name.
So you me from my studies from the primary school onward, interest will come. So another 10 minutes will pass. So meantime somebody will come.
So that much experience he have 15 years of experience in homeopathy. He gave his entire life to the homeopathy and spreading homeopathic knowledge to the world. Now also he is giving training. He's sharing his knowledge to the entire world. That will benefit everyone. And he is the retired principal of Government College, Calicut.
Not retired.
I told already, retired medical.
I am a former principal.
And former principal of Calicut Homeopathic Medical College. And moreover, he is our honorable president of International Forum for Promoting Homeopathy. We have proud about him, and we are celebrating his 50 years of experience. Golden Jubilee celebration is going on everywhere in the world. For last 2 days, we got an opportunity to hear his experience and cases. That is more valuable experience he shared. Today also, he is going to share about Down syndrome. Sir, please welcome.
Thank you. Thank you for giving me the opportunity to this forum. This forum is my forum, your forum, and to deliver a lecture on the Down syndrome. But see, Down syndrome is very, very, very much for homeopathy. Any mental or physical, more than physical, we are having the mental symptoms. Either it's acquired or the other thing. This is a Down syndrome. From the birth onwards, from the intrauterine life onwards is the starting. The chromosomal changes happens on the uterine life after during the fertilization period. We are having the medicine for that, but from that period onwards. I am trying this some of medicines to giving the correction of this one. And of course, the chromosomes of the cardiac studies are maybe same, but symptoms may be changed. And I cured so many cases from my 35 years. I have started this one actually. This method I have started since 35 years. That is I calling as prenatal care treatment. Prenatal care treatment. What is the mathematic play I am giving? Mathematic aspect. The Sornum, Medorinum, Syrupinum, Togophonum, like that. Only 4 medicines cut all the calamities of this Down syndrome as well as the other features. And meantime, I am explaining it. So anyway, we are having a much scope. But in mathematics, suppose we are going to download the Down syndrome, we never get anything. Any material, any triple not showing, I think so. So far I am trained. So many mathematics is not showing anything Down syndrome medicines. But we have very valuable medicines. Very valuable medicines. That's a few one. Within few medicines we can achieve a lot. We can do some 1 days. Baraita car, Kalkare car, Matrambo, and Tarindilla. Exactly we are talking. Next so make. But from the uterine onwards, suppose we have find out this one. Nowadays we are having a conveyance to confirm the fetus level. Now, this is very, nowadays it is much. They have to undergo, the pregnant lady undergo the ultrasound examination for the prenatal care, or that's an rule out the abnormalities. The convenience are there. From which we can correct it. From which. So, my advice to all homeopaths should encourage the method, prenatal scan. That means to identify the rule out the anomalies of the fetus. They have wonderful medicines. From the intrauterine onwards, suppose we are treating this one, we will correct it within the time of before the delivery. All the companies we can correct it. Suppose the child came out from the womb, it will take 3-4 years to correction. That doesn't not complete 100%. This is 100% we can assure. This method, with only 4-5 medicines we can correct it. Suppose that the child came out from the womb with the defects, you have to much effort you have to, and even after 4 years we will correct it up to 70%. The 30% we will lose. Because the anatomical changes was happened, physiological changes happened, the brain as well as the other organs, that we can't correct it in 100%. But here, the intrauterine rape, we can cut 100%. They have so many experiences. Suppose anybody comes to my clinic for training, I will give the assurance. I given the learning subjects for them. Not anything hide. Whatever I learned from my experience, that all knows by my students. That's my habit. That's my theory. When one system should come out from the world, we should give the information to others. Then only it come up. Otherwise, the old Vaidyas are doing. They are doing wonders. They keep mum. They are even not showing to his own daughter or son. I know one of the Vashagari is there. They're treating with the poison subjects, poison snakes. He was under my treatment last time for cancer. And I told you, he never knows anything about this. His knowledge to his son or son-in-law or daughter. He's having a good garden there. That garden of 40 acres of the garden. 40 acres of this herbal garden. I wondered, even then, the children and grandsons not knowing anything about this treatment or something like that. He said, expect. The knowledge, Indian knowledge he acquired, has gone to his body. Nobody knows it. That type of practice is going on in the Ayurveda and some other. We homeopaths should engage our juniors to learn much than us. Then only the system will come up. Then only we will know. Father, that's up to my father having 80%, I should be 90%. My son should be 100. That method should be adopted by everybody. Otherwise, system will not develop. Otherwise, the system will be doomed after our death. Okay? This is the introduction I'm giving to my juniors as well as my friends, everything. Somebody is hesitating to giving the information about their knowledge. No, don't say like that. Everything is right. Suppose we are getting experience, 4 or times when we confirm that is experience, you spread to the others. Then only our system will come up. Okay? It's my request, it's my earnest request for all my juniors as well as my friends. Thank you very much. Then I'm going to continue my section. Please share my In my classes, don't expect much more cases. In the seminar, the open seminar, of course, I'm giving to 1 hour speech. One hour speech. It will last for 3 hours and 4 hours like that. They're talking and giving the information, everything is going on like that. But in the section, this section, I'm explaining only two or three cases already. The Down syndrome. Yesterday also given the 3 minutes. Therefore, yesterday given only 2 cases. That's my thing. But he can ask the questions to correct my method so that I can explain it. But anyway, I'm having some damage of my back. I know to sit more than 1 hour here. That's the curse. After inshallah, after my getting my back cut, I can sit for 11 hours. I'm sure you. See, we will begin with this Down syndrome. Also known as trisomy 21. It's a genetic disorder caused by presence of all or part of the third copy of chromosomes 21. It is usually associated with physical growth delays, mind delays, moderate intellectual disability. The characteristic facial expressions are there. It's the Down syndrome patient having a peculiar look for the face. Any experienced doctor can say he's a Down syndrome. You can say that because the peculiar features are there. Mongolic look is there, Mongolic look. The average IQ of this young adult with Down syndrome is 50 already, equivalent to the mental ability of 8 or 9 years old. But nowadays, this practical life, now 9 years child having the much more knowledge about the adults. They're asking something like that. One day they're asking. And old child and all time. But this can be very widely. See, this is another things is very normal or all common to all the things. I think it will be in the our Facebook or in the record. You can download and say this one all the. These are common things, no? These are common things. I'm not going to explain it much. You please cooperate with me, okay? Thank you. These are the things I'm telling. Maybe you can read it. And it will be available in the forum. We are recording it. We are uploading to the Facebook so that everything you will get it. Comment. Can you read? Try to read it, right?
Yes, sir.
Otherwise, later you have to download it. I think that is better. Average IQ is, very 35 and to 50. The very severe condition will come down to 20 to 35. Intelligence 120 IQ and 120 and 140 like that. Genetically downwards in this question you are there. So reading is very difficult for me. Let's go through this one. Then laterally you download it and read it much. Because this is the essential thing. Maybe in the classrooms it is not giving that much of description. Now I am going to describe the trisomy 21, Down syndrome 21. 21 is very common, very common. Other things are a very rare one. The 13 is a very, very rare one. That's also I am going to describe. Let's try. This 21 is a common Down syndrome. The features are Mongolic look, The face was having the peculiar atmosphere there. But we can see it on the after delivery. We can one of my friends, Dr. K.V. Peters, my sister, born a child, and he got some doubt about that one. He called me. I said, "Sit down syndrome," because the pictures are very clear with it. The child was. I was treated the child that time. That time I'm not having that much of knowledge and everything. Even then I given some medicine and got it something. And he may die with 24, 26 years old. Because his life also will be single. Actually, maximum they get only 45 years old. Maximum age they're getting 45 to 50. More than that only. So this is a karyotic type 47 plus double Q double X plus 21. For the female, is 47 3XY plus 21. Caused by the failure of the 21st chromosomes to separate during the egg or sperm development. Non-disjunction. As a result, the sperm or egg cell is produced with the extra copy of the chromosome, so 21. This cell thus has 24 chromosomes. Then combined with the normal cell from the other parent, the baby has 47 chromosomes with 3 copies of the chromosome 21. About 88% of the cases of trisomy 21 result from the non-separated separation of the chromosomes in the mother. 8% from the non-separation in the father, and 3% after the egg is sperm having the merge. Case 1. Straight away I am going to the case 3. The baby, he came to me at the age of 4 months old. 4 months old. That time they shown them features. And they think this child was crying unnecessarily by the evening. By the evening only they cried. So that they brought to me. So I saw that some features are different with her child. So I told them to the Down syndrome children can treat it, will correct it some extent. They cooperated. They are taken the medicine from the 4th month onwards. It's carried type 21. She is under the treatment since 3 to 2016. They are presented with the produced. Sorry, this is not in that case. Okay, sorry. It's the second case. And this is the 2016. She presented with the reduced clarity of speech. Which started with the Beretta Carponum, 2 doses, and Calcare 4 6s. Same pattern was continued for just 7 months. She showed gradual improvement. Later, Sornum Tenum was given as an intercurrent. 4 months later, for further improvement, Moderators Tenum, and after 3-4 months, 50M was given. Now she is able to do her daily routine activities by herself. Her speech was improved at the age of 4 or 5. They discontinued. So that much improvement we can give. But these patients the parents are not cooperative with us in our ways. Because after some development, they will stop the medicine. They see that it's okay. It's okay now. My child is taking the food, taking the change of dresses, going to the bathroom and washing it, enough. But in the part of the brain part, we're not developing that much. So that they may be shown some idiotic signs, idiotism. They are not cooperating with us. They are maybe after 3-4 years, they will put up with treatment. So that actually the relation will become even improved. That's why we can't assure any further. Actually, in my experience, we have to treat the child for 7 years. then we can correct it some 70 to 80%. 80%. I have a lot of cases like that. So case number 2. Baby is a baby of 5 months. Or basically I told that one. 23/4/2007, she was a diagnosed case of Down syndrome. The supplier presented with a developmental delay. After detailed case taking, we started our treatment with the Beretta car. Don't mistake that Beretta car only the medicine. Beretta car with the niche medicine. Calcare car with another good medicine. Tanla Spania is another medicine. And Naxomic is another one. Calcare car is there. So many medicine we are, but we are having the much action, more action with the Beretta car, and more action with the Moderators. Corrections. So Beretta car 1 arm was given. I'm not giving the 30 or 30, but straight away I'm giving to 1 arm. And CP 6, CP Calcare 4, 6. That is to the calcification because this Down syndrome having some anomaly with the calcium, serum calcium. So that I am not missing CP. Medicine was continued for the further months. The Moderators 1 arm was given as an intracanal dose. She showed gradual improvement on the speech after the first year old. After that, we think 13 or 14 months, he is calling Mama, Papa, like that. Pucha, Patti, some words spelling. On 14th month onwards, she joined the normal school. After, of course, they have taken the medicine for 5 years. They have joined the school. After they taken the medicine, meantime, there's so many changes was happened. The speech will develop. She sings the songs and telling the combined words, common words, reading by seeing the pictures. Everything she should develop. So that she go to the school admission, the normal school. Other kids, she was slow in studies. But only thing, other students are very short to study. That means maybe 50% speed. This child has only 30. 30 might be. During that time, Calcare of 10 number was given. After the 1 number potential, not 1 number, after 1 number of had administered many times. Maybe I am given 10 doses or 12 doses in the interval of 2 months, 1 month like that. So after this one, after joining the school, I given the Calcare of 10 because she's developed this sweating on the head. She's not taking the milk properly. They're compelling to give the milk with the adding with the other things. That means the Bonvita, Horlicks, later. The color should be changed. Then only she takes. The color of the milk is not black. That's why I'm given the Calcare of Prenam. And the medicine was continued for 4 years. 4 years. She showed a good improvement in speech activities. Due to her improvement, they stopped the treatment. On the 9th year, on 8th year, they stopped the treatment. I think not the 9th year. So even 7 years old, she stopped the treatment because that much they attend. They thought that it is enough. Everything is good because she's changing the dress, going to the bathroom and cleaning it, and asking for food, taking the food properly of the Calcare. So they stopped the medication. They came after 5 years. 5 years. At the studying of the 7th standard, she completed the studying of the Bharatanatyam. Meantime, that time also I told her one matter should be very excellent. So you give the opportunity to dance items. From the 4th year onwards, I am studying because when any songs come, he will changing his body here and there. So I told them, you just try the dances so that you will deliver. She studied Bharatanatyam and Mohiniyattam. She presented their temple. So many times. So I was also called for the inauguration. The extracurricular activities of the school. She joined the extracurricular activities for running and 100 meters running and the spoon running. There is so many items they conducted. They again started the treatment 3 years back for their menstrual regularity service. Menstrual menses, the change of the 12th year. The puberty got to the 12th year. Okay? Like these children, suppose we are not treating properly, they need to go to 17 years, 18 years like that. She got the puberty menarche at the 12th year. This is child. See how beauty she is. Sometimes she is coming to my hospital and Papa will go to doctor because he want to eat the masala dosa. So meantime he is coming there and I am offering for the masala after. So they are giving it. The time. See, this is a case, very wonderful case. That is the extrauterine treatment. It's the intrauterine treatment. As usual, I am not having the much scope earlier my treatment, but by the grace of Almighty God, they are given the medicine after my word, and she is corrected everything. You see that. This case was referred by maybe you are something say something. They are very Sai Baba discipline. So they went to Pataputri. And I was asked studying everything. She told that you nearby your they also belong to Alapi. In your country, and nearby one doctor is there. He's not doing the allopathy or normal method. Somebody uncommon medication. You show she will be all right. That time she got the nephrotic syndrome. At the age of 10, she weighed 75 kg. It's a square child, no? The bottle was in one heroin bottle, the square with the cap, no? Like that she should at that time. That time I am not that much conscious what to take the bottle, everything. That is due to the steroids used for the nephrotic syndrome. 30 years old, she came, daddy was an old patient of mine, now staying in Kuwait, called me in a grief and explained to me the details of her features abnormality and how all the doctors there were compelling her to terminate her features. She was my patient for nephrotic syndrome earlier. At the age of 10, she weighed 75 kg due to the overactivity of steroids, and her complaints were cured within 18 months of treatment. She started avoiding every treatment. One 18-month treatment. What are the treatment? She was all right. She looks very normal and everything there. That time she got the cholesterol. Then cholesterol was 2,100. Very high cholesterol. This much cholesterol comes from the normal man. They will go to the cardiac attack. But in the nephrotic syndrome, it's a common thing to raising the cholesterol level. That time she got 2,100 cholesterol. And after the treatment of the 18-month treatment was controlled. I think I forgot the medicine given. I think first of all I given the medicine Ifph modifica, followed by Maxol, then Tobocolinum. She corrected, and within 18 months she corrected normal. She started avoiding every marriage proposals after that. When got the time of the marriage, the proposal comes, they are avoiding all the marriages and even decided to not to marry anyone as an allopathic doctor. Their friend said, told that her cured disease, nephrotic syndrome, will back as a CR. The bad norms was arising in the mind. That's why she taken the medicine, taken the decision not to marry. 37 years. That's a story also there. Her brother came to me at the hospital. That time I was running the one hospital, the baby memorial shelter there. The boy, his brother was coming there for IVDP complaint, and everyone is told to ask them to do operation, but they are denied it. That's when they came there. I put on the traction, I given the medicine, he corrected. Meantime, I asked about this girl. She is the eldest sister of the boy. I said, very skara now. You married? How many children they got? They tell you, no. She not at all married so far. They avoided the marriage. They think that her the old couple will come back. So I asked them, my parent, bring her here. Before the discharge of that boy, they came to me. I asked, why you are not married? Uncle, they called me uncle that day. Uncle, these are studying by some of the doctors. See, I told them, see, I treated you. I covered you in the protection zone. I am the only person to say any complaint comes for you. Nobody is not able to say anything. So I am telling you are not having any complaint comes back, you go and get married. Next time you are coming here, you come with your husband. Okay? I told you that a positive energy was given. Anyway, she came back to his office. That time one boy was transferred from Calcutta. They got love, they married. They married. That's the way I told you, no? But she was convinced, and soon after her brother was discharged after complete recovery, she met the right person in her life and got married, and to him and settled in Kuwait. Later, when she became pregnant, her scan was taken, confirmed the complications and anomalies, if any. So later they saw that some anomalies were there in the brain, or the heart, and the kidney level. So they diagnosed that this in the indirect continent. They got they are taken to the Europe. Converted site. This belong to the child is belong to trisomy 30. She came back from the Kuwait and then consulted very popular gynec in Malappuram, but he too advised to terminate on the 5th month of fetus. See how there. So they are telling your child will die on the 8th month, 9th month, or immediately after the delivery. He will not live in the world more than 7 days. But the posture of looking is very fearful. He will not stand, look, he cannot tolerate it. That's why we are to cut the fetus and remove it. So they came here. So that they came to me. I just sent all the stories. I told that, okay, fine. You are not going to deliver it. You are going to taking the child after the delivery. Okay. So do one thing. Don't cut the fetus. This Brunakatya, the crime. Don't do it. You deliver it. Maybe the child will die. Next time you will get a good child. Okay? That's why I should have given. That way, she convinced, okay, uncle, I'll do that one. This is better, such and one. But meantime, your husband is agitating. They are telling that suppose anything happens in your life, I will not attend you further. I will divorce you. He shall just call this. Even then, after my word, they stand on the treatment. Okay. He's not her features. His features come from the trisomy 7, usually. Don't think that this girl having this much of various things. No. I am telling for you, showing you for the information. Even after knowing all the consequences she all have to face if she gives birth to the baby, she did not want to terminate her baby. She came to me for treatment in the 5th month on her pregnancy. I started my treatment on 8/12/7 antenatal care treatment. But I'm not having the much time to give the antibiotic because I started this month on 3rd month onwards, this 5th month. So I am not given the antibiotic. Straight away I got it was given the treatment for the next day. Antenatal treatment for her. As she came here on 5th month, pregnancy, I was not able to give her the whole course of the medicine. As by experience, the universal congenital anomaly terminator is Moderator. So I given Moderator 10 2 doses, was given on 8/12. You just see the dates of the okay? 8/12/7, 8 in the morning. Of course, I given the for other things for the believing I given the placebo therapy. Then the universal and vital organ corrector, brain, heart, and kidney, the sibylinum. Because sibylinum is having the correction method of the deteriorating organs. So 10 was given on 28/2/2008. Then all-round mathematic medicine, the tuberculinum. 10 was given 1 dose, was given natural day. 1 dose only given natural day on 12/1/8. Oh, it was a feedback. Oh, 12/1 I given the medal sibylinum, and 28/1 I given the tuberculinum. Mistakenly, wrongly is not like that. Please correct it.
Okay.
Anyway, you remember 28/1/2008 I given Medanino. That's what it is. Sibylinum. 10. Again, next course I given the tuberculinum on 28/2/2008. Am I right? Am I right?
Maybe
Somebody say yes or no?
Maybe 12/3, sir.
Eh? No. It was mistakenly come from the like that. Because 28/2 I given the tuberculinum, 28/1 I given the medanino. Tuberculinum. 12/1/2008 I given the sibylinum.
Okay.
28/2/2008 I given the tuberculinum. Correct casualties. Okay. Am I right now? You got it? Say yes or no. Somebody.
Still confusion, sir. There is.
Yeah.
Which commission?
1, 2,
See,
3.
I was given medanino. I was given 8/12.
Yeah.
2008. Again, I was given 12/1/2008 this sibylinum.
Okay.
Again, I was given tuberculinum by 28/2/2008. Now it's okay?
Oh.
It's mistakenly typing
Yes,
mistake.
sir. 1, 3, 2.
So I'm very sure. This case, I'm very much sure. I'm knows this one. That's why I'm cut it like that. It was happened. The typing mistake was happened.
Okay.
2 comes to 3 and 3 comes to 2. That's ulta mar gaya. Okay.
Yes, sir.
Then the promoter of the blood for a Metallicum 3x, 4 grains twice daily, calcium, potassium level maintainer in pregnancy, calcarea 436, 4 grains twice daily, also started from 3rd month onwards. From 3rd month onwards. 3rd day of the every given potencies. Suppose I am giving the high potency, the next day and the next day I am not giving anything. Even I am not giving the placebo. I am giving this potentage after the 3rd day of the potentage medicine. I started the parameter on calcarea. These are the report taken from the very good laboratories. And suppose you get the and recorded forms there. Just to go through. Any doubt comes in the letter even, you ask me, I will correct it. Okay? See. Patient's father-in-law is not allowing person to this case so far. But the mother of the patient is agreeing, and grandmother is agreeing, and the uncle was agreeing, everyone agreeing. Only father-in-law of the girl, the Kala, not allowing to present this. They think that suppose they are presenting the case, the contributing, something. That's why they are agitation. They are not they are not allowing me to present this one. I was present in the case on the round table class, the Wayanad, while Dr. R.P. Patel was there. These are so much studies there. Studied. Maybe we are also not aware of this. Today, gynecology. These questions are given. The trisomy 13 is confirmed by these doctors. Consonantal level. Then intrauterine life also they have taken the root correction from the baby and checked it. The report taken this one. Ultrasound scan was taken on 5th month and 6th month of pregnancy, showing ASD anomaly in the heart of the fetus. But 7th month, USG revealed that no such anomaly on complaint was corrected by our anti-miasmatic medicine. Under the cesarean section, she delivery performed. A very healthy child was born. The child shown social smile on 17th day, 17th day of pregnancy, for the delivery. That is an extraordinary brilliant child. Normally, the intellectual child gives social smile only between the 1 to 2 months. Here, this child shown his social smile 17th day, which points to that fact that the child is normal and extraordinary brilliant. That after delivery, the looking child like this. She is the mother. I hold the patient of nephrotic syndrome. She said, now she is delivering speech, sings songs, extracurricular activities are there. Speech is competition of going for the speech competitions, got first level prizes, like that. Even 3rd month, 4th year, 3rd year, he is asking some question to my parents. Parents not able to answer it. That type of questions he is giving. So, this is the end of my Down syndrome system. So many cases are there. Suppose any time comes, I will show the different varieties of the this one. Only because of which one importance I am giving it only 2 cases. One first case I am not suppose I am not thought to include that one first one. Only second and third one. So, child was studied Bharatanatyam and this one Mohiniyattam.
Thank
That
you.
much level she developed without medicine. That also treatment in the after the intrauterine life. But that child was good. The treatment for intrauterine, but that also late. Even then, we can given that much of level of improvement. So any doubt comes, you ask me. Yesterday, I got some complaints from the audience that immediately after we return to other matters, they are not able to ask in some doubts and questions. They are not given this one. So immediately our Zoom controllers are entered to the other matters and return to other matters. They study as well as and I got the more than 8 or 9 cases phone calls from the female doctors. One doctor is retired from the CMO, and the other doctors are from RFP. Dr. Joseph was he was given even a voice message also. So that should happen in anybody's class. Suppose they stop in the class, you should begin there. Any doubt from any side? You will ask.
Yes.
Okay, sir.
Please.
Thank you so much. Actually, these are the miracles of homeopathy and
This
excellent.
is not a miracle. Listen to me. According to homeopathy, this is not at all a miracle. We have the proper medicine for this one. But maybe somebody is not knowing homeopathy system. They will think that is a miracle. It is not a miracle. We should use the thing. These are the usual things. You know, I attended my mother's heart attack after the 3rd month of my marriage. I married on 1975, January 2nd. He got the attack on March last. I am myself attended. My mother is not allowed to get into the hospital. I given the medicines. The 3rd attack was given by my wife because I was at the Trivandrum, Ministry Hall for discussion. She given the medicine. She survived. She died on 96 years old already. 96 years old she died without any complaint. One day she was taken to the hospital with the chest pain. The doctors examined. No, nothing wrong with her. There's no scar also. Maybe that time he got any gastric complaint like that. So I found this ECG at that time we were taken. That ECG very funny ECG. So they confirmed it. He will have confirmed the case. He was a known cardiologist in the RFP, Medical College. He was a consultant of the Sheikh Zayed, Abu Dhabi. He asked me to join the medical college for treating cardiac asthma. That time, your father, Shamsuddin, and Dr. Habib, Dr. Chandramati Divagar, and Dr. Ibrahim all told me, no, not go there. Maybe your name is coming up, take anything. Maybe they want to you in the doubt, settle down. So I thought maybe correct and not good. After my Abu Dhabi life, after the publishing money papers, and I started the herbal clinic under the government, federal government. That time before the convention of the homeopathy, conference homeopathy UAE, I was got the chance to treat herbal clinic because that time I went to America for a conference. Meantime, some Arabi came to me. I given the medicine for carbuncle. He cured it. So he is the friend of the Dr. Sait. He went there, asked him immediately. Dr. Sait was started a herbal clinic. And asked me to join them. I went there. I see that it's not homeopathy, herbal. So I delayed it. But due to the compulsion of my friends, Manavali Muhammad and the girlfriend who's editor Aslam, and even one Arabi, he compelled me to join there for 1 year or 1.5 years because they have tried this one so many times that not achieved. Due to this one, achieved, please. So I joined there. And the Kuwait people getting the Ayurveda medicine, herbal medicine there. I am also given that one. Telling you frank. Meantime, some of my the herbal doctor in charge tell me, allow me to get the medicine from the outside. So somebody was coming and consulting me and getting the medicine. They are getting from America, from the Germany. After 2-3 days, you'll be getting it. Within 2-3 days, you'll get it. And they given the medicines. That's the thing is going on. That thing.
We'll go for question.
Okay.
Any question, please?
Yes, Sridhara Kurup sir, is raised hand.
Team Sridhara Kurup, sir.
Yeah.
Please mute.
Yeah, you can unmute yourself and.
Yes. Thank you very much for calling me. Whether it is audible?
Yes, sir. Yes.
Yes. Thank you, Ismail Sait, sir. A wonderful session. It was wonderful, really speaking. That I also like to add one case that it is in 2009. I got one case. It's a 3 months baby, Irfan from Kodungalur. He was lying that if he may turn this side, he will lie that side. If he may turn this side, that boy will side, not turning or not opening the eyes or anything. But that it is too difficult to a child to treat because there is no symptom. The only one symptom I observed when the mother told that when the child is taking milk, there is sweating in the cheek. Only one remedy in Ken's repertory, that is chamomilla. So I gave that chamomilla 0/3, few doses. But for calcarea for 6x is continuously it was given. But 1 tablet daily 3 times. But after one month, the child started moving. Then the 4th month, another observation, that was the child was sleeping with half open eyes. Lycopodium 0/3 was prescribed and calcarea was continued. But after that, one year, the child was not able to stand or not able to stand on the leg, even not by catching to the hands in the chair or any other place. So that I again studied that I gave that sulfuric acid 30 potency and calcarea was continuing. Now the child may have that the more than 12 years old. Before 5 years old, they came to my house and they met me, and I came to Bombay. After that, I don't know the how that he is, but he was cured completely, except 2 things. One, he was having some stammering, and he was having some shortness of his forearm. That was the only 2 defect. Otherwise, he was perfect. All other, he was dancing and running and talking and walking, everything he was doing. That was my first case. Second case, that while I was in Udupi in 1998, there was from Manipal, one Manipal hospital was in Bangalore. There one microbiologist, that her first pregnancy, she was suffering from jaundice. Then all doctors, gynecologists, all they suggested her to abort. That her mother belongs to from Udupi Brahmins. She approached me, and she was my regular patient. She was so worried. Then she asked me. I told her I shall give her. If it is that side, the God will not allow the child to burn. But they are telling there will be some malformation will happen. But however, I give the first that medicine, I give that to the medorinum and along with the cardus and the chelidonium mother tincture and natron salt 6x. Anyway, after that 10 months, after full term she delivered, there was a boy, very beautiful boy. I was calling that it is my child only. I told that her, if the child has some deformity, give to me. I shall take that the child. If it is healthy, you take. The child, now the child may have that at least 20 to 23 years old. So I am still that I may go to Udupi. I have contacts. The child was absolutely all right. Thank you very much for listening. Okay.
Next is Dr. Danish.
Good evening, all, and good evening, sir. It's an excellent presentation, sir. You really stunned the audience because of your presentation skill and your presentation. You are having a lot of cases with you. You are really tracing the treasures of homeopathy, and the hidden. You find out some of the hidden treasures in this world of this Down syndrome, autism, and all those cases. You are the forerunner for all these things, and we are the followers. And of course, we are also getting this kind of patients. And I am also having, I have already presented a case of a girl child in this platform, but I didn't explain about that because that child was the granddaughter of the lady who was having prolapse of rectum. Prolapse of uterus, and I have presented it in my presentation some months back here in this webinar. So that child is getting a very, very high improvement, and now she is just like a normal child, and that's the reason why homeopathy, because of the leadership taken by you and our forefathers. I mean that doctors like you are really thrilling us to take challenges of this kind, and we are also getting the beauty of homeopathy in these cases. So it is really really a wonderful session, sir. It is really wonderful. And I have got another case of a Down syndrome patient who was having also same problem, but that boy is also improving. And very recently, some 7 months back, I got a call from a mother who is crying that she was supposed to abort the child, about the fetus at the 5th month. And some of her relative asked them to call me, and suddenly I was able to prescribe the medicine. And frankly speaking, within 1 month, everything was cleared. And very recently, she called me and she delivered a beautiful girl child. And this is the beauty, because we have the confidence in homeopathy because of our doctors like Ismail Sait, who is running and who is ready to share everything. And because he has shared all his knowledge to some of his juniors, particularly Dr. S.G. Biju got a lot of information from sir, and he really published all these things in some of his textbook, and that really gives us the courage to trace all these things. And thank you very much, sir, for your this kind of presentation, sir. We are expecting more and more, and if I get one more chance to present here, definitely I shall come out with that case once again, sir. I got a video from this from the child family, and definitely if I get one more chance in our webinar, definitely I will present it here. Thank you, sir, once again. Thank you. Okay.
Thank you, Dr. Danish. Next is Dr. Hubert. Dr. Hubert, you can ask your questions.
Oh dear sir, can you hear me? Oh dear sir.
Wonderfully. Wonderfully, I hear you.
Sometimes we have to take decisions. You made that decision in their intrauterine life. That is a great thing.
Yeah, practice this one since 35 years, no?
Yeah.
Successfully.
That was
33 years.
in such conditions. We cannot have the dare to take that case. What will happen? We don't know how. If the child is, if they have any malformations, we are blamed throughout the life. We have to blame. But that time you took such an important and highly dared decision, and to allow them to give them strong counseling. And this is only because you have some godly merit. That is why somebody said that you have some mandravadam.
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 Or Andravadam.
Somebody says that Ismail
No,
said is treating his mandravadam. Yes, so
No
this is all God's
Mandravadam is
grace.
against for Islam.
Yeah, God's grace. These are all God's grace. That
God
is
is
why
grace.
you can take such a decision in such conditions. You are
Suppose
truly
we are sincere to our patient, no?
you are
Suppose we
truly a
sincere to our
leader.
profession, definitely we'll get the answer. Definitely. No doubt
You
at
are
all.
you are truly a leader, and you are the God's blessings always be with you. Thank you, sir.
Thank you.
Thank you very much.
Okay. Dr. Logamani.
Next is Dr. Lokamani Gupta.
Hello.
Yes, sir.
Sir, good evening to all.
Good evening.
Really a splendid presentation and achievement. God is great, and after God, you are great. Very wonderful and splendid, motivative case presentation. Sir, I want to know, please guide something about selection of the potencies. As in your cases, you are giving very high potencies also. Please, we can reach up to the medicine, but sometimes it is very difficult to select the potency of the medicine. Please guide about selection of potency. How can we guide, and the homeopathy can reach up to heights in all the corners of the world. Thanks for your good guidance.
Yes, sir.
Thank you, sir. Next is Parit Babakan, sir.
Hello, beloved said, sir.
Thank you.
Assalamu alaikum.
Walaikum salam rahmatullahi.
I am really excited to witness your excellent presentation. No doubt about that. I am the only homeopaths to make a reference now. I have no suitable words to express my feelings on the subject you have made. For everybody to have this cure is other. We have to express our thanks to God Almighty. Wish you all the best, sir. We will be praying for you to continue your service to the humanity. All the best. Thank you very much. Thank you.
Thank you. Thank you, miss.
Thank you, sir. I think there is no other questions here.
Yes.
So, Shaji Kudiyat, sir. There are many. Dr. Badran. Dr. Badran.
Thank you for the chance given Dr. Sait's excellent presentation on Down syndrome. Down syndrome and such congenital anomalies can be well managed by homeo medicines favorably. Many of the cases of Down syndrome and congenital diseases, ASD, VSD, etc. responds to homeo medicines very well, and they lead a normal life, and they live without the support of anybody. Such miraculous cure can be made by homeopathic medicines, which I have experienced very well. And I congratulate Dr. Ismail Sait for his nice presentation and inspiration. And the inspiration given to the doctors is very high. Thank you, doctor. Thank you.
Thank you.
Thank you, Dr. Badran. And now I am inviting Dr. Shaji Kudiyat sir for, now before that, we have a video presentation. Let me check. Dr. Shaji Kudiyat, please come forward and to say a vote of thanks to Dr. Ismail Sait.
Okay, thank you. Thank you. It is nice to have the great presentations and the sharing of experience from our beloved Honorable President, Dr. Ismail Sait. He is part of our forum. He is the president, and it is unusual to say, and there is no reason in saying vote of thanks to him. He is part of our every activity and everything. But for the sake of an official proceeding, I extend my wholehearted thank you to our Honorable President on behalf of International Forum for Promoting Homeopathy and all those who gathered and attended these 3 days. There were complaints of deviating from Dr. Ismail Sait's talk to other discussions yesterday. I also received few complaints of deviating from the discussions. So anyway, that much interest that audience has shown.
Not my complaint, no?
No, not your complaint, sir. The listeners' complaint. But that shows how much the participants are interested to listen to you. So anyway, we are all proud of you, and we thank God for your wisdom and having such an experience to be an example to homeopathic doctors around the world. And this is also wonderful to tell the world that the diseases they declared incurable are easily curable, manageable through homeopathic medicines, which are capable of working and influencing its effectiveness, going beyond the physical plane, but influencing the energy components of our existence, whereby the entire deformities can be modified. These are all examples for that.
This, doctor, there is a request from Dr. Mr. Kamal Shah. Dr. Kamal Shah. The chat box. You would like to say something?
Okay. Yeah, please, Dr. Kamal Shah, please. You unmute yourself and say, yeah.
Thank you, Dr. Shaji. First of all, Assalamu alaikum to Dr. Ismail Sait. I have followed you for 3 nights, and it's a wonderful presentation. I myself, I'm not speaking on behalf of the homeopaths in Malaysia. I myself am afraid to use high potencies like you do. Okay, and moreover, you are using nosodes. Wow, it's wonderful. I wish I was your student, and I hope one day I will propose to the association in Malaysia so that we can invite you, for a short course on homeopathy and share your experiences with us in Malaysia, inshallah.
Okay.
Thank you, Dr. Kamal Shah.
Welcome.
So thank you again, Said sir.
Yeah. I will coming, Benjamin. After some time, I am coming again
Yeah.
with the
Sir
cardiology.
Yes, yes. Sir will come back again. We are all ready to listen to you, sir. So tomorrow again, we will have another session with a discussion, panel discussion. So we appreciate your presence in panel discussion sessions also, because this is to inspire and bring homeopathy to further heights for the sake of this generation and generations to come, to convey and transfer our wisdom and this new and different level of healing methodology, so that we all will be inspired and will be able to inspire others and convey and transfer this wisdom to the new generation. So we all need to work together to make it happen. So discussion sessions are also important. I appreciate all of your presence in the coming days of sessions, and a few days after we'll be celebrating our 300th day. Your prayers and your support is needed for us. Respecting all these, we wind up today with another big thank you to our Golden Jubilee celebrant, our beloved President, Dr. Ismail Sait.
See you.
Thank you and good night to all.
Before ending, we have to give him a standing ovation.
No. Use it.
So, thank you, sir. Thank you so much.
Thank you. Thank you for appreciation. Thank you for acceptance as a maybe a speaker on homeopathy. We have lot of collections in the homeopathy field. Lot of averages are there. We should open it as a sea. Suppose you go into the deep sea, will collect more items from there. Like that, homeopathy also like that. Suppose studying well, properly, depth into the homeopathic system, will get more action. I don't think that is a homeopathy limited to some other diseases like that. We can treat all the diseases that we are born in the earth. I believe that one. You see the COVID, the new area come, but we got the treatment. We cured many cases. Our junior doctors also cured many cases. We are preventing, but due to the business lobby, not giving us to much courage, much ability for the engaged homeopathy. That's a fine. That's a pathetic conditions. That's a cuts for homeopathy. Don't know why it is happened. Anyway, we will all together lift the homeopathy as our own health, wealth, so that it will come up one day, definitely.
Thank you, sir.
Thank you,
Thank
sir.
you for listening. Thank you very much.
Thank you all. So we can close today's session.